Yeah, the snap on the holster gave way. He stood up over me. He said, "I'm going to fucking kill you." And he pulled the trigger. I saw the flash of the muzzle, and I looked down to see a hole in my chest. I suffered some head trauma. I also had a broken collarbone from the impact of the bullet. My wounds were also included it was about the size of a quarter and almost a half-inch deep wound into my chest, even though they said without the vest it was a fatal shot. The second bullet lodged, it was a ricochet shot, so it lodged 4 inches into my arm, and that was removed at the hospital. To say that when you talk about the incident, it doesn't bring you back, it absolutely does. And I think it also can catch you off guard, because you think you're fine, and then all of a sudden you're like, wait a minute, I can hear my voice cracking, I can hear my voice wavering. And, this was almost 6 years ago. And it's really, to me, it'll always be yesterday. It's never going to be put in the time perspective that most other people know it as. I was also in shock, but I didn't know that I was in shock. So people would tell me things, people were trying to give me advice, kind of telling me what might be coming down the road for me. And I really it didn't register with me, because I was overstimulated. I remember being in the hospital room and hearing the heater in the hospital room go on, and it clicked. And I was awake in a moment's time. It was just as if everything happened. My senses were just overstimulated. I got diagnosed with post-traumatic stress disorder a month after my incident. I didn't really know at that point why I was labeled as such. I knew I didn't sleep well. I knew I was having night sweats. I was hypervigilant. I was very aware of when anything happened around me. I didn't go back to work right away. When I left the hospital, I was living in an apartment at the time. I went back to my apartment. My rib had healed enough where I could go running again. When I tried, I kept on thinking cars were going to take me, that somebody was going to jump out of the car and kidnap me, that I was going to be attacked again. So my regular everyday existence came to a screeching halt, because I always thought somebody else was going to injure me or hurt me in some way. And so I just kind of retreated into myself. My mannerisms were very hyper. I just was very much having trouble being in control of a conversation, of being calm. I was very forgetful. I missed appointments a lot of times. A lot of it had to do with the stress and the trauma, things that were not normal for me. And I didn't trust being with anybody because I thought that they were going to hurt me. It really did limit my existence. I didn't realize that trauma takes longer than the physical wounds to actually heal. And I really didn't have a good comprehension of what was going on. I returned back to work in the same car, and I kept on having feelings that it was happening again. There was no way that I could interact with anybody without thinking the result was going to be another fight for my life. I look at it this way. When you go through a crisis, you get broken apart, you're able to put yourself back together. When you live through a trauma, you're shattered. And you can't put the pieces back together, not the same way they were. I think it's a matter of being able to put them back and erect a new life. And that's a grieving process. It's a very long process for it to take place. And as I said, although I was already labeled with post-traumatic stress disorder, I didn't know what it was. I probably went through 10 therapists. And then I was able to keep it together for about 1.5 years. But for law enforcement officers, trials represent closure. So it was 1.5 years after the incident. I testified on June 8th. I testified in March. I knew things were not going very well. This is in March 2000. By June 8th, he got sentenced to 18 to life up in Attica. And by June 9th, I was sitting on a therapist's couch saying, I can't go back to work. Putting on a uniform caused anxiety attacks. I thought people that were driving next to me in cars on the road were going to pull a gun on me. It was so bad that I could no longer function. I would be mowing my lawn, breaking down into tears, I was out for 3 months in 2000. And that was all related to the trauma, the emotional healing. Will I say that I don't ever think about my incident? I think about it every day. But instead of it overwhelming me, I can at least kind of live with it. You know, it doesn't have as much as the spark or the edge that it used to have. When I used to have intrusive thoughts, where the thoughts would just kind of, you know, in fact, it was what I would hear in this thought that I would get would be 10:33 a.m. and then him saying, "I'm going to fucking kill you." And that was when I wouldn't be thinking about the incident, and then that would appear. So that doesn't happen. Do I think of my incident every day? Absolutely. But does it debilitate me? No. And as far as dealing with somebody who has mental illness or is emotionally disturbed, it's interesting because when I speak about it, especially to recruits or other officers, I tell them, you know what? If you look in the DSM-4, I'm there. Post-traumatic stress disorder is a mental illness. So, you know, if anybody were, heaven forbid, have to respond to somebody in emotional crisis, you know, give them respect. Give them their dignity.
Okay. What stuck out with you about what Officer Tully, how she described? Were there any phrases or items or something that she said or something she described that maybe resonated with you in terms of how perhaps participants in your court are maybe having some difficulties around trauma, that if you didn't know what was there, maybe you would respond to it differently? Yeah.
Well, Mr. Sam goes from rehabilitation to learning how to live with the trauma that you've experienced in the past. Mm-hmm. That was big for me.
Learning to live with it. And she mentions that it's a crisis, you put your pieces back together and you go on. But a trauma shatters you. And you can go forward, it's different. It's a new you, really. And she also mentions how it's important for treatment and for patience. What kinds of activities was Tully not able to do that maybe we hold our participants in treatment courts to that they may not be able to do? Yeah.
It was just simple making appointments, saying that she forgets. And as treatment coordinators, we try to stay on task and encourage our clients to attend outpatient, attend counseling, seek their psychiatrist, get the medications they need. And when they miss a step or they forgot or they slept or they put another priority in place, you know, sometimes as a coordinator we get frustrated and think, oh, if they only made it, but how difficult it may be just for them to get out the door, just for them to get where they need to get.
Yeah, the keeping appointments and being on time, and not to mention public transportation isn't necessarily the most reliable way to get somewhere. Yes?
I think what was really interesting for me was the fact that it made me realize, like, the clients that we work with, she was mentioning how important therapy was and how it helped her get through the process. A lot of the clients that we deal with don't have the resources to get into mental health, to get into therapy, to get into all the treatment places that they need. And for us, I feel like that's the missing piece because they can't really deal with the trauma. Therefore, they're in our program relapsing and relapsing because as much as we help them, it's almost like a dual thing where if you can't get treated for the mental health piece, we can't help you completely. Mm-hmm. So
and integrated treatment is really important. Right. If people have trauma histories and they have, substance abuse, mental health, trauma, it's together. Because, and one of the things that you said too made me think, and Tully talked about this, we have very high expectations in terms of time and making appointments. She went through 6 therapists before she got help. Okay, now she had the resources to do that because she's a police officer, but how many shots do we give people? And there may not be 6 providers anyway, but in terms of, sometimes we talk about there being, I don't mean we wouldn't do this, but other people say that clients are treatment resistant. Well, there are programs that are client resistant, and that's something which we sometimes, and if you have someone with a trauma history and a substance abuse history and they're going somewhere where it's a mixed group, for example, and they have a sexual abuse history, they probably don't want to be in a group with people who remind them of someone who abused them. So it's really, again, starting from the position that trauma is pervasive. It's pervasive in the population, but especially with this population. And it also has that, remember that event, experience, effect. Keeping that in mind, it's all three are important. Okay, yeah, go ahead, sir. Thank you.
I just can't help thinking about the triggers that, for example, listening to the heater kick on when she was in the hospital and how, and it just those things. And this is a one event, very traumatic event, of course, in her life, one event. And the people we work with, have major traumas repeatedly over years, usually. And how many triggers are there in their lives? I mean, and how do you avoid that? How do you, train people to deal with that? I mean, as a judicial officer, it's not my job necessarily, but I need to be sensitive to that, to the fact that they're, avoiding triggers or talking to them about the triggers in their lives that cause them to relapse and cause them to have other problems.
And I think that's an excellent point. And didn't you just experience that with her when she said it? You knew immediately, you can see how that click would have that, she would have that response to it. And it's in trauma-specific services, triggers is a big part of the conversation, also avoiding those and also desensitizing people to those triggers. I remember a story of a psychiatrist who was supervising a man in New York City, and the guy wouldn't go to treatment. He said it was so frustrating for him. The guy would never show up for his appointments. Well, as it turned out, the only way he could get there was to cross the street at the intersection where his brother had been gunned down. But it took a long way to get to understand he wasn't resisting treatment, but he couldn't pass through that space where his brother had been gunned down. So people have a lot of trauma and a lot of triggers that go with that, and it is very, I think one of the most puzzling questions that providers have, that all of you who work in treatment courts have, is which people are going to develop, say, PTSD. Not everybody who is exposed to traumatic events develops PTSD. And what is this thing about resilience? Because I'm always in awe of people who have horrendous experiences and still seem to put it together, and seem to be able to make a life for themselves. And I think that there is that, and that's really, this depicts, it is this combination of risk and resilience. We would think that Officer Tully had a lot of resilience. Okay, she was trained to expect some kind of risk. She was trained for that. And hers was, as you say, was a singular event. And many people, especially people who live in extremely disadvantaged neighborhoods, the unexpected happen all the time. And there is this hypervigilance that comes as a result of that. And people who have experienced trauma have a distorted, and I don't mean that as a joke, it's an unrealistic expectation of how risky their lives really are. They are riskier than many, but not as bad as they think it is. So getting on the bus really isn't dangerous. So getting to really at the nub of that and understanding that this hypervigilance, this extreme anxiety that gets triggered or is just, it's so pervasive, that really is part of the therapeutic process, is understanding that the whole world isn't that way. Okay, and otherwise you don't leave the house. Okay, and I'm sure you have clients who don't leave the house or don't want to leave the house. And part of the way our programs are structured, and again, there probably are as many ways of doing a drug court as there are people in here. But some people are really uncomfortable being in front of the rest of the drug court participants. They don't like people behind them, or they don't want, it's just something, they're not being resistant, they just aren't comfortable with that. And it's something which, again, is this a requirement that they be in front of everybody with lots of people behind them, or is it just the policy? Is it just a habit? Yes.
Very big question. I don't even know if you can answer it. It might be too premature. But in talking about resiliency and trauma, I'm wondering if children dealing with trauma versus adults dealing with trauma, because children don't have all the resiliency that an adult might have because of life experiences, would it be more difficult for a child to get over the trauma, or let's say for a client who has dealt with trauma early on versus later on in life? Does that make a difference at all?
My immediate reaction is that's above my pay grade to be able to answer that question. That's a very clinical question, okay? We do know that childhood trauma that isn't addressed it just follows you throughout your lifetime. We do know that for sure. This is just an aside. Speaking of childhood trauma, I have to tell you what I got to do this last week. I was on a site visit in another state at their prosecutor's office. They have have you ever heard of Canine Companions for Independence? They're puppies actually raised on a puppy farm in California. They just got their dog in the prosecutor's office to work with children who've been the victims of, in most cases, child sexual abuse. And the dog is part of the therapeutic process, a way of getting them to be able to talk about what had happened to them and